Welcome back to Insights. I'm joined by ACC Professor of Political Science Tim Kuhnlein, and we were just discussing the division in America. But it seems like most people kind of want to strive towards a bipartisanship in Washington and around the country.
Well, the studies are showing 8 in 10 want bipartisan solutions. And this sense of bipartisanship is less intense. The demand is less intense than what we saw back in 2008 when Obama was elected. And remember, those were highly contentious times. We had a financial collapse. We also had 8 years of a pretty tumultuous realization of the Bush administration and what it represented. And there was a lot of anger. I mean, Bush kind of went out as one of the least popular presidents. The election of Obama then brought in the Affordable Care Act. It was sort of a glacial reaction in the midst of that financial crisis and so forth. So yeah, it's interesting to see where we are now, all this reaction to the Affordable Care Act and the sort of glacial shift in our politics. Counties and states going from Obama in the last 2 elections to a Trump vote this time. It's like the American people are trying to force the national structures and the party orientations to respond to them. And
it's kind of a reactionary, almost opposite shift from what they've seen in the past.
And it seems like from these studies that if you really stop and think about, and you listen to some of the messaging of the people who are, really trying to voice or articulate their support of Trump and what Trump has apparently honed in on, even though the Republicans and the Democrats didn't see it, is that people do, it appears as though we're very divided, and we are, but people want, they want solutions, I think, and they want it done in a way that we don't go in draconian directions in either direction. In other words, we need fixes for these problems because people are really struggling. And it comes back to the finances and all of that stuff that are pretty dramatic right now.
And so let's talk about one of the main dividing factors right now is the idea of this Affordable Care Act, or what's monikered Obamacare.
Right.
What do you think? Why do you think there's so many people against it? Why do you think there's so many people for it?
Well, the reality is it didn't make it very affordable. And so in that sense, I think a lot of people are extremely frustrated. But the reality also is that most people want the fundamental components of it. It's just, it didn't do the task. And part of that is that, again, the partisanship played in. This was almost an entirely Democratic Party initiative in that reaction. The Republicans abstained, became almost obstinate in dealing with it because they didn't want another government program. Even though Republicans created the largest expansion of a social welfare program with prescription or Medicare Part D and prescription medication for the elderly since the creation of Medicare. But here we have Obamacare. It's here to stay. Republicans, I think, have realized that it's not complete. They're never going to get rid of it entirely because it's actually the fundamentals of it are quite desirable. But finishing it is the story. Now, whether it'll become retitled Trump Care or whatever, let's remember the legislation was the Affordable Care Act, and in that sense, it's failed quite miserably. It has, however, brought some very important provisions for a lot of people, and it has expanded the number of people covered by health insurance, which for those of us that are covered by health insurance is a good thing because we don't have to pay their costs as much as when they don't contribute. If you just look at some of the things that people like, because I think it grounds the discussion. I mean, let's remember, this is a private insurance system still. This is not Medicare in the strictest sense. And even with Medicare, it's private oriented. Medicare recipients go to private insurers, right? The amount of money that went to hospitals to improve their infrastructure and their services, that's a huge boon. The coverage for up to 26-year-olds, that's a significant population.
For me, yeah.
Exactly. And I think we've all been in that situation. Right. The pre-existing conditions, of course, and also the lift on caps for chronic diseases that insurance companies would basically cut you off at a certain point. These are, even Trump is saying, these are all very positive outcomes, and even most Republicans.
I thought that was very interesting too, because huge talking point was, well, we're going to get rid of Obamacare completely the first day. I'm going to sign it off. And then after he got elected, he was like, well, I took a look at it now. He's like, I kind of like some of the parts of it.
Well, and I think that when this first was introduced, Republicans, for the most part, didn't want any government involvement whatsoever. Well, it's a reality. It's there. And now the question is, okay, how do we make it work in a way that fits with their philosophical view and the practicalities, because there are practical problems with it. This is not a perfect piece of legislation. And one of the major shortcomings, of course, everybody's mad about the mandate, right? Nobody wants this sort of thing mandated, especially those who can't afford it. And the effect that it's having on small businesses and their bottom line, that's one of the problems that people are reacting to. The expansion of Medicaid has actually been, for the most part, a desirable thing. It's helping states cover the costs of their poor. And although when you look at it in cost of government, where's that money coming from? People start getting critical. Why should we pay for that? Why expand that? It's going to be a hard one to find a balance and equilibrium on. And then I think the other problem is the amount of money necessary to subsidize those who are in the low income or poor categories. Where does the money come from? We're obviously not elevating taxes enough to cover that or a lot of other things. So I think it's cost, and choice are key things when we look at the problems. But at the center of this, and I think this is where Trump is onto something, is the interstate commerce. The fact that the original Affordable Care Act did not take into consideration the cross-state sale of insurance. Part of this is that insurance companies didn't want this competition. Right. And they lobbied heavily. And then when you look at the obstinance of the Republican Party, this became a Democratic initiative. They took what they could get. And there's something now. And the Republicans are almost forced now, and Trump, to take what's good, fix it. They'll rebrand it probably, and move forward, and mission accomplished, let's hope. Because it's a serious problem, the affordability of healthcare in this country, even for those of us who have it. So this interstate commerce thing, I think, is a big issue.
All right, well, we're going to touch on that in a little bit, and we're going to continue this discussion of the Affordable Care Act, so don't go anywhere because there's more insights coming up after the break.